Hi, my name's Tamsin and I've been a qualified physio for the last 18 years. I thought I'd tell you a little bit about how I became interested in physio and my career path so far. So as a child I was really sporty. I loved taking part in any sport and I also loved watching sport on the telly. I remember watching the World Cup in Italy in 1990 when I was 12 and seeing a man running onto the pitch to help an injured footballer. And I remembered thinking what a cool job that would be. And then a few years later, I remember watching Andre Agassi win Wimbledon in 92 and again seeing a trainer run onto the court when one of the players was injured and helping them out. And what I hadn't realised at the time was that both of these people were actually physios. And then later that same year, we were on holiday when my grandma became really ill and was rushed into hospital. And she ended up in intensive care after an operation. And when we arrived at the hospital, there was a lady there with her who was helping her to get some phlegm off her chest. And she came back over the next few days and she worked with her on getting her leg strength back, on getting out of bed, and then getting her up and walking again. And it turned out this lady was a physio as well. So by that stage I still loved sport, but my favourite subject at school was biology. So I started to think that maybe a career in physio might be for me. I definitely knew that I wanted to do something where I was helping people, but I was also thinking that of maybe becoming a doctor as well. What I hadn't realised was quite how competitive it was to get into both medicine and physio, and I also hadn't realised how important it was to get some work experience before you applied, which I hadn't done. So I didn't get offered a place on either course, and I actually ended up going to the University of Dundee to do an anatomy degree for 4 years. And I had a great time there, and I really enjoyed learning more about the human body. But the more I learned, the more I became sure that it was actually a physio that I wanted to be. So to improve my chances of getting onto a physio course, I arranged to do some work experience during the summer holidays at the local hospital and also with a private physio, and I also worked in a nursing home. So I was absolutely overjoyed when I graduated from Dundee and got a place in Cardiff to study physio. So I spent the next 3 years training. It was a really hard course. It was very much 9 to 5. There was lots of practical elements to it. I was really fortunate. I had 12 different clinical placements during my training, and I was just absolutely amazed at the variety of areas that physios worked in. So this included outpatients, orthopaedics, intensive care, amputee rehab, stroke rehab, paediatrics, mental health, hydrotherapy, the list goes on. So although I'd very much come into physio thinking I wanted to work in sport, I quickly realised that there might be some other areas that were actually more rewarding and that I would enjoy more. So what most physios do when they first qualify is that they get a rotational job so that they can experience different areas of physio and then decide what area they'd like to specialise in. So that's what I did, and I got my first job in Edinburgh as a junior physio, and I rotated every 4 months, and I worked there on elderly rehab, respiratory medicine, stroke rehab and intensive care. And then after a few years I moved to Wrexham in North Wales and I worked on orthopaedics and outpatients. And I got a promotion while I was there and worked on stroke rehab and intensive care again. And I really realised by then that although I loved working as a physio in any of the settings, I really enjoyed working with patients who'd been really poorly and needed a long period of rehab to get back on their feet again. I loved seeing these patients every day. I loved getting to know them and seeing them steadily improve. And I really found the best places to do this were in intensive care or on the stroke rehab wards. So the other thing that I'd really wanted to do as well was to go travelling. So I ended up getting my registration for New Zealand, and in 2006 my husband and I went travelling, and I ended up getting a job in Christchurch in the South Island, and I worked there in orthopaedic rehab, pain management, on the spinal injuries unit, and then also just as a general locum in the big hospital there. And it was just absolutely amazing to be the other side of the world doing exactly the same job. So when we came back to the UK, I'd really decided that I wanted to specialise in neuro rehab. So I ended up getting a specialist rehab job in the Royal Preston Hospital, and I worked there on neurosurgery, elderly rehab, and then neurology. But by that stage we'd had a family, and I decided, although I loved the work at Preston, I just didn't want to do the commute anymore. So I ended up changing jobs and came to work in Lancaster. For the next 5 years I worked as a rotational physio between intensive care and surgery and the medical wards. And although I really enjoyed the variety of work, I just found that it just didn't quite have the same job satisfaction that you get on stroke rehab. When you're on stroke, you just play such a big part, and you're so instrumental in the patient's recovery, and you just never get tired of seeing a patient walk again for the first time. So 6 years ago, a job finally came up in the stroke team in Lancaster. So I initially worked as a specialist physio in the team and seeing patients both in the hospital and at home to hopefully get them back to as much independence as possible. It's a really varied job. Sometimes we're doing lots of strengthening exercises with patients, whereas other times we might be doing lots of balance work to get them back to getting the bus into town, or to get back cycling or swimming, or maybe just to get back out into the back garden so they can let their chickens out. Every patient is really different, which makes it really interesting but also really challenging as well, which is great. I've actually been the team lead for the stroke therapy team for the last 3 years, so that's meant moving away a bit from seeing patients, and it's more about managing the physios and the occupational therapists that work in the team and making sure that we're providing a great service for all of our patients. I would say the best thing about being a physio, and particularly a stroke physio, is that you just get to spend lots of time with patients. You get to know them, and you're just helping them in a really practical way to get better and to get their life back after what's often been one of the worst experiences of their lives. And as well as the joy of seeing them get better, you also get massive job satisfaction from knowing that you played a big part in that. And a job doesn't really get much better than that. The other great thing is that it's just so interesting and varied. I still learn new things every week as the science and the guidance changes. You're always really busy and you're on your feet, so there's never an opportunity to get bored, and I would just never want to do anything else. It really is just the best job in the world. Thank you for listening.